afternoon, everyone. Namaskar. Being the last session, I think it is also very difficult to have that sort of attention from the audience as well as hold the audience. So I'll not like to be, I'll try to be as quick, as brief, and as interesting as much possible in my short talk, what I'm going to present today. This talk is about my new alignment with a health tech organization, a US-based health tech organization, India Health Link, which is already available in India. Most of you would have seen our HPod, IHL HPod there at the entrance in the stall of India Health Link, and also would have experienced it and done your testing, various vitals tested in just quickly 3 minutes. So this is about this whole concept. It's not only about HPod. This is about this whole concept. First of all, many thanks to the organizers, the 9th Global Conclave of AEOHD Occlusive 2022. I have a long association with Dr. Swadeep Sharma and Dr. Pawan Gupta and team, and I am very thankful for that association and thankful to Dr. Sharma and the whole team of AEOHD. And the theme of my talk is also very much connected to the theme of this conference, that is fostering health, well-being and environmental sustainability for future-ready organizations. So I am not going to talk about fostering health, well-being and environmental sustainability because I'm a lesser expert than a lot of experts who have spoken before me on these topics, starting from some of the talks which I heard from Dr. Jan, a stalwart in this field from railways. We have been hearing him for many years in these conferences, from NHPC, from very delighted to hear the talk of the Hero Motor Group on the extensive and in-depth, very organized work which they are already doing in workplace wellness, and congratulations to them and such organizations who are already on the forefront of workplace wellness. My talk is more about future-ready organizations, because future-ready organizations in today's world means how to integrate digital in what all you are doing. Various aspects of organizational functioning, including workplace wellness, corporate health, whatever you call it, it's all about the wellness of the employees, for the people, the whole culture of wellness. How you can integrate technology, I think that is what a future-ready organization should actually look at, whether it is a corporate organization, MSMEs, or the PSUs, Maharatna, Navratnas, Mini Ratnas. All these organizations, their work is incomplete unless they integrate technology into what all they are aspiring to achieve in all the fields, and particularly wellness. This is what we at India Health Link and our founder, Dr. Satyendra Goel, who is based out of Chicago, he has been able to achieve this and develop this during an R&D of 6 to 7 years, which he has done to bring this whole technology and the ecosystem of wellness using digital. And why we call PHYGITAL, of course it is a little different than metaverse, because metaverse is purely digital. There is nothing to touch about. Here, wellness, what we felt is incomplete. Anything in healthcare we have seen is incomplete if there is no physical touch. That's why we brought in this PHYGITAL module of physical and digital combined. So just to give you an introduction of what is IHL Care Digital Health Center, is first of its kind integrated heart health program that complements corporate wellness, providing customized health solutions. The HPod which you saw outside is brought by IHL Care, is a self-service ATM-sized health station. It is capable of screening 20 plus essential vital parameters, including 3 key parameters like blood pressure, temperature, body mass composition, pulse, SpO2 and ECG without any paramedic assistance. This underlying without any paramedic assistance is one of the most important factor to note, because we are sitting in India. India is a country where everything is available in healthcare except the real trained manpower, whether it is paramedics or the shortage of doctors. I don't want to go into numbers. Everybody knows the level of shortage of doctors. Government has been shouting. We all have seen during the pandemic, the COVID-19 pandemic, what it has meant for us in terms of shortage of the healthcare professionals, the trained doctors, the paramedics and nurses. And today we have, as a country, we have an ambition of launching the Ayushman Bharat program, and then recently launching the National Digital Health Mission. Why National Digital Health Mission became so important to be introduced to complement and support and complete the Ayushman Bharat initiative of the government, because the government realized that without digital and technology integration, the level of shortage we have of our trained professionals they will not be able to deliver healthcare, particularly at the grassroots level, at the bottom of the pyramid, and at the level where they have an ambition to start more than 10 lakh health and wellness centers. It's not possible without the support of digital and the PHYGITAL model, where India Health Link also fits in very well. So about the founder, Dr. Goel, with whom I joined hands recently, is the world's what he has developed is the world's first consumer-centric health and wellness platform. He has spent 15 years in the healthcare ecosystem in various roles, including Chief Science Officer at Colibra, a data intelligence company, medical school faculty. He still teaches at Northwestern University and as an advisor to several healthcare companies. He's filed more than 10 patents and is a serial entrepreneur with the latest exit in a patient privacy technology startup. This is passion which has brought it here. Myself, I have joined them as president and CRO, and my role has primarily what I'm proud of, and that's what I learned during the time of COVID, is how lucky I've been to be in healthcare, like most of the professionals sitting here, that I have been committed in healthcare improvements for the last 25 years. I've done nothing else, I've seen nothing else, I've experienced nothing else. I've only worked in the field of healthcare awareness, communication, and a lot of other aspects of healthcare improvements, using various tools, working with all sort of organizations across the country, across the globe, whether it is private, development or government organizations. And when I came across this technology, it was so thrilling that I said we should join hands and bring it to the forefront in a country like India, wherein this is so much required, particularly with respect to giving a major boost to preventive healthcare, primary healthcare, and including the AI, artificial intelligence and predictive technology to achieve the goals of preventive healthcare and fulfill the targets of providing primary healthcare to the nook and corner of the country. This technology, what you have seen, I would like to just take 5 minutes to explain about various technical superiority. What this has, you just see it as a small ATM machine outside, but it is a clinically validated medical device, which is world's first system by an independent hospital system in India. 30 years of R&D platform used by Hughes Corporation in US for 250 million lives. They have done this screening in US. You'll find in pharmacies, you'll find in communities, you'll find in hospitals, clinics, everywhere. A lot of places where Americans have been using it. A lot of other countries have also adopted it. Only kiosk with an integrated 6-lead ECG scan without paramedic assistance. So generally the complete ECG is 8 leads or maximum 12 leads, which is used in hospitals. The 6 lead is quite enough to give the initial sign of disturbances, what it covers. You can see the whole the technological attachments like biometric. It has got a biometric access. It can be operated in local language. We have made it in about more than 12 languages. You can operate in Hindi, in Gujarati, in Bengali, in Marathi, in South Indian languages. There is a payment UPI system, so you can incorporate it for the payment. You don't need to have an assistance every time to collect payment. There is an inbuilt camera, RFID, LAN Wi-Fi. It works on LAN Wi-Fi, offline mode service, and automated email messaging and inbuilt printers, thermal printer. What it does is very quickly run on to 20 vitals. Mostly I would say they are metabolic health vitals, from BMI to blood pressure to temperature to pulse to SpO2 to ECG, body and visceral fat, bone density, minerals and protein content. Lot of questions which we always come across, we came across when we were here on my stall, is why not other blood tests. All these things can be integrated, but we wanted it totally non-invasive, whatever tests are possible in the quickest possible time. But tomorrow you want to add blood sugar testing, HbA1c testing, or HB hemoglobin testing. There are so many point of care devices which you can integrate with this system, and all the reports will be integrated, all the data will be integrated. So when and it can be used even up to a level that you can add multiple probes. So tomorrow you want to add a probe of say gynecological women checkup, you can add that probe also. You want to add a probe for skin diagnosis, you can add that probe also. So any probes you want to add for different type of, even ENT and dental check cameras and probes you can add. So all those things can be added. There is a telemedicine setup inbuilt, so you can connect to the telemedicine with the doctors. You can customize the telemedicine program. That's why we as IHL we consciously decided not to build our own branded telemedicine. So recently, just 4 days back, we launched a center, a zero assistant digital health clinic in Khagaria, a small place about 100-150 kilometers away from Patna in Bihar, and we integrated the telemedicine of Apollo hospitals there. Similarly, we are working at Gangaram Hospital. They want to build in their telemedicine program and take it to various places. So it's an open source where we have just now put one in Goen Hospital in East Delhi, where they are creating a telemedicine ecosystem and an EHR system for their own doctors, for their own labs, for their own pharmacies. So it's an open source program which you can use to customize as per your need. So you can see the user platform, mobile and web, both platforms are available. You can download IHL Care app, and as you download, you fill in your vitals and your details. Your IHL account is created, which is integrated with the ABHA account of Ayushman Bharat, and it's like your health record where you can maintain and take it anywhere you want. You also become you access to the marketplace. Like this is also open source. So we have just not tied up with Raksha for You, Raksha TPA, Raksha for You program for corporate wellness, and there we are using their marketplace. So they are deploying our experts in their corporates. We are using their marketplace, but we have our own marketplace also, where you can go and book your pharmacy, buy medicines at discounts, book diagnostics, everything what you want to select as a corporate, as a piece, you can do there. So employee journey, again, I am not the right person. Most of the experts have already talked about it. But what this technology does is to sort of do a non-invasive vital screening to create a personal health account and give access to health and wellness marketplace, and also integrate that individual through the corporate, through the HR department, or individually into our overall wellness ecosystem, which we call IHL Care Wellness Ecosystem. We just recently introduced the IHL product, wherein the MSMEs, small organizations at a very low cost, from 50,000 rupees to 2 lakh rupees per year, can become a part, and all their services except export will be given to them on an annual basis for their 500-1,000 employees, which costs hardly 100 rupees to 200 rupees per annum for any employee of an organization, where you become a part of their wellness ecosystem. Now, similarly, you see what type of data which come out. So one of the most vital, and this is very important, a lot of our experts are doctors, medical experts here, some nurses are also here. So it's very important to aspect, we talk about non-communicable diseases. We talk about the diseases starting at the level where one is diagnosed with generally diabetes or BP diagnosis. If you see, it happens at such a later stage. So generally a lot of population would have high BP at the age of say 30 years, but generally their diagnosis happens at 40, 45 years, 50 years, quite late. That is very common. So what this system does is while you put it, the two highest risk factors of hypertension and obesity, that is overweight. This is the starting point for any non-communicable disease, is diagnosed as early as anybody who has access to it from 20 years to 25 years to 30 years, and that diagnosis is very critical. That's what we have seen at Gangaram Hospital. The figures are showing very small, I don't know why. But generally what we are seeing is that about the risk of hypertension and BP of about 500 staff we have just screened at Gangaram Hospital is about more than 45%. About 45% of them in that high risk of obesity and hypertension. And of course, if there is any complemented cases of even disturbance in ECG and other risk factors which the doctor can evaluate and then further recommend to get it tested. See how the reports come, very simple, very easy to understand, easy to see. We already have started in India. I have started with them about 3 months back. They started just before COVID, and we are associated with some large corporates like Persistent Systems, like Imami. We did a 1-year trial with Dr. Mehta Hospital, which is a documented, published trial in peer-reviewed journal of the accuracy of the data of this HPOD. We are there in Ramaiah Hospital. In Gangaram Hospital also, we just completed a trial of 500 people, wherein their data from HPOD, the tests and the reports were compared with the data manually done by the Gangaram nurses, and we see 100% or more than 100% of the accuracy there. So we have got multiple partners. We have gone aggressive in India. Now first time, I think this is the first formal conference we are attending in the form of being there physically available, rather physically available with the HPOD also there with us here. So this is the first, this is just the beginning. We are going to do many more across the country. We have got tremendous response from all main cities, from Delhi to Bengaluru to Hyderabad to Chennai to Mumbai, and more so we want to work with the governments where we already have a very good acceptance in the National Health Authority and Ayushman Bharat, and we want to take it at a large scale in India. As I told you, the Ask IHL will complement as a weekly wellness e-newsletter, health tip of the day, the newsletters, and every Thursday IHL Wellness Matters show, which we are doing, bringing all wellness experts and making it free, accessible to all our members who are coming on IHL, all the corporates and all their employees who can not only be a part of the shows, a part of those deliberations, discussions, talk to the experts, learn from the experts, but also ask their queries and those will be answered. And of course, we'll also give some telemedicine program into that so that they can even chat or talk or get answers to their queries on a regular basis. But most vital is the central part is the device, that's why which makes it PHYGITAL, and this device is very unique, very simple, can be upgraded to any level. I was just listening to what Hero Group team was telling about various things they are doing in terms of the health score, the selecting a companion, and a lot of other programs which can be automatically integrated in this device. When we go to the doctors and clinics, why they are delighted? They say, हमें camp करने के लिए, health camp करने के लिए, we need to have the whole logistics in place. Ask for devices, different devices. Ask 2-3 nurses to sit there. Ask a doctor to sit there. Then where to record their data. So we have created a mobile health van where we have put this device in that mobile van, and this is going as a mobile health clinic. To all these doctors are using it at their clinics. The hospitals are using. We are going to communities. We'll go to the corporates, PSUs. Then you can use it as a program, as a screening program, the basic vital screening program. If you want to add any such point of care for pathological diagnostics, that also can be added and integrated. So this can become a very big enabler for the screening, the basic level screening. The challenge of India is to converting informal sector to formal sector. There is more than 40-50% of the population who have not visited hospitals and clinics, and they are not into that formal system wherein their records are there, but majority of them are suffering from many risk factors, particularly obesity, BP, and other risk factors of blood sugar or all those things, which are not captured. These such devices, easy to use devices, when made accessible, and they will play a great role in capturing those data, bringing those sort of population into the formal sector, wherein a wellness program can be devised around them.